Okay, we're rolling this morning. This is Friday the 9th, and we have our patient here, Becca. You're a relatively new patient for us, right? You've been in just a few times, okay? Do you mind, now, we're not going to share any of your personal identity, but I do want everybody to know that you have diabetes, right?
Yes.
How long have you had diabetes?
For about 2 years now.
Okay, so a couple of years, and you're on a couple of medicines here, one of which is metformin, but you were told to stop.
Yes.
You're on losartan, which is antihypertensive that actually also offers some renal protective effect for your kidneys, and then of course you're on Jardiance for your diabetes as well, which has a glucosuric effect. However, that's not why we're here. We're here because of what is going on with these legs, and we're going to play a little game with our fans, and we're going to say, guess what's going on with Becca's legs. Now, this rash, so everybody knows, does extend up into, onto the thighs, and look, put your hands out there too for me.
Okay.
Yeah, because you can almost see this is not something that's just in that spot. Okay, good. All right, and this showed up how many days ago?
Ooh, it's been already going on a month.
Going on a month ago, and you went to the emergency room first.
Yes.
And what did they tell you was wrong?
They were just saying some type of bacterial infection or something that's fighting each other.
Yeah.
It's just going terribly wrong.
Right. So they gave you antibiotics.
Yes.
Okay, let's start number one. The emergency room was wrong. This is not a bacterial infection, okay? Not that they didn't try their best and do well, but they're just wrong.
Right.
Okay. All right, and so after that, they gave you a referral to see a dermatologist,
Correct.
Is that right? Okay, and you went and saw a dermatologist, and the dermatologist made a diagnosis for you, which I happen to think is possibly wrong. He or she told you 2 different diagnoses, and
Yes.
they did a biopsy. Okay. All right, one of those 2 diagnoses that he or she, was it a he or she?
It's a he.
A gentleman. Okay. So one of those 2 diagnoses, I do completely agree with. The other one I do not. But I want to get a good look in here, and you can see this ulcerated crater that has formed here. And you can see you still have some blisters. We call those bullae, right? And then you've got the deep, dark red. It's okay if I touch your...
Yes, sir. That's fine.
Because since I know this is not a bacteria, I want to get in there. I want to push on that for you. You can see when I push on those, it doesn't take the redness away. And guys, what that means is rash does not blanch. That's what that means. Let's look over here again. So we got Becca. We're going to play the game Guess the Rash, okay? And then in a couple of days, we'll get our guys to put the name of
really
what
bad.
this is. So you were on some of the correct, you were on the correct medication at first. Look at that. That's really got to hurt. Are you having a lot of pain with that, or is it just...
Yes. Oh my gosh. Yes, it flares up at
So I'm going to get you some pain medicine too. But we're going to play the Guess the Rash game. And you guys, I want all of you to know that I got Becca under good control here. We're going to get her on back on the correct medicine. She's not currently on the correct medicines, but I'm going to get her back on them. She's at one point, she was on the right medicine. So we're going to do that, and then we're going to go ahead and make sure that that we get this taken care of. Hopefully later on down the line, maybe you could come back and let us see it heal.
Of course.
Would that be cool?
Of course.
Okay, so we're going to get her some regular medicines, and we're going to get her something for pain, and we're going to get her the right medicine to treat this problem, and give you guys an opportunity to play Guess Becca's Rash.
Right.
All right? And you're okay if we video you for YouTube and all our friends on the internet?
Yeah, that's fine.
You're awesome. Thanks.
No problem.
Meta 7 combines 7 vital nutrients that boost your metabolism. These essential nutrients boost your energy level and may even help you lose weight. The goal of Meta 7 is to help you activate your life. So if you are feeling a bit sluggish and want your energy back, try Meta 7 today.
Hi you guys, my name is Gabby and I'm here to do my testimonial on Thernergy. Thernergy has given me way more energy than I had in recent months. It's helped me lose about 20 pounds and I'm really happy with my current body and thin form that I have. So please check the link below, recommends Thernergy, and I think it'll work for you.